I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth Program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So we'll have Dr. Malitha Patabendige, who is the acting consultant at Base Hospital in Patabendige in Sri Lanka. And that actually brings me to Dr. Malitha Patabendige, who's speaking to us from Sri Lanka, and their experience in implementing in Sri Lanka. Dr. Malitha, you were one of the leaders in setting up the SCC and being able to set it up in Sri Lanka. And I'm wondering if you could share a little bit about some of the challenges you faced and how did you overcome them?
Yes. Good evening, everyone, and thank you, Dr. Katherine. So, in Sri Lanka, when we take so we have some improved maternal statistics in the region, but we were stagnating for about 8 to 10 years, and we were unable to bring down maternal mortality rate less than 30. So we were searching for new searching for new strategies to adapt, and this WHO Safe Childbirth Checklist was one of the new strategies. So we adapted in one of the major maternity hospital, and we found new prospects. We found new things what we do in Sri Lankan setup, in our setup. Then we went on to a context specific one, and which we thought would be the best thing when we are implementing a safe childbirth checklist. Of course, in Sri Lankan maternity setup, there are formal checklists. That means some of the items in the WHO Safe Childbirth checklist are already there, but those checklists are different from one hospital to another. Like that, there is a heterogeneity. So this checklist, we hope that this checklist would do something very good, and the context specific one, making the checklist suitable to Sri Lankan setup, suitable to Sri Lankan guidelines, and making it familiar to our healthcare personnel. And I think it help a lot in increasing its compliance and of course its adherence, etc. So at the moment we are practicing it in two hospitals. One is a teaching hospital, other one is my hospital, which is a peripheral hospital. So our negative thing is we couldn't get any support from the statutory bodies like Ministry of Health and our Family Health Bureau, and we are still convincing them to expand this program. Hope we will be able to do it in near future. So that's it, and I think in next few years we will be able to expand it into few other hospitals. I mean our new context specific checklist, and we have included some points which will improve the quality of care, including the respectful maternity care, like that. And when we are making the checklist context specific, I hope that this checklist will be able to provide some quality care for our mothers. And thank you.
Wonderful, Dr. Malitha. Thank you so much. I think one of the things you've highlighted well is that adaptation piece is so critical. And I think that's one of the
Yes.
most important messages about the checklist implementation globally. It has to be adapted for the context in which it's working. And that means
Yes.
changing it for national guidelines, frontline care staff, the supply availability at a facility, the cadre of worker, because again, a checklist is not just for a nurse or an auxiliary nurse midwife or a midwife or an OBGYN. It can be used by
Yes.
all. And I think that's an important piece of the messaging.
And
I actually
one
think
thing
it's,
that I
oh,
have to
yes,
tell,
please go ahead.
and sorry, Dr. Katherine, one thing that I have to tell that people are reluctant to introduce these kind of things to maternity system. So what can I say is pilot and see, then you will see the difference. Pilot and
That's right.
see, then you will see the difference in whatever the hospital, private, peripheral, tertiary care, whatever.
Excellent point. I think pilot and see is important. I think evidence, this is where data matters. As an epidemiologist, that's close to my heart, I will say. But I think also being able to show the changes that are possible. And we've seen consistently that behavior change works with the Safe Childbirth Checklist. One of the questions is, where is the checklist used? Who is the checklist used for? Is it everybody or a particular delivery? So what was your perspective?
Yes, thank you. In my perspective, we use for all laboring women who are entering the labor ward.
Mm-hmm.
And
So,
some women will go into spontaneous vaginal delivery, operated delivery, some may leave the labor room for an emergency section, whatever. All the women who are entering the labor ward, we are administering the checklist.
great. Thank you so much, Dr. Malitha. And I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. You know, it's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from CAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators, who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey. And we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing. And we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today. And next year, let's all meet together and see the success and where, after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.